Hello, my name is Dr. Adams and I'm a dentist at Maryland Holistic Dentist in Burtonsville, Maryland. And today we're going to talk a little more about root canals. There was a documentary titled Root Cause that came out on Netflix a few weeks ago. And we have had a lot more people calling our office and scheduling appointments because they're concerned about root canals. And they will have certain questions like, are root canals bad? Would the root canals make me sick? Will they cause cancer? Will they cause lupus? Should I have all my root canals removed? And I just want to set the record straight and just go over, what I found throughout my practice about root canals and really what the bottom line are with some of these issues. And of course, these are things that I've learned on my own during practice. I've literally removed hundreds of thousands of teeth. I run a specialty practice where we deal with TMJ issues. That's where people clench and grind their teeth, and people that are missing teeth and they have groups of teeth that need to be put together in a way where they function better. And long story short, I'm a holistic dentist, but we treat things holistically, but us holistic dental people still do specialize in certain things, and I've gotten really good at anything involving removing and replacing teeth. And since I've removed a lot of teeth, I've gotten the opportunity to see firsthand what causes teeth to be lost, what the teeth look like when they're removed. And I've been able to, maybe most importantly for this video, start to form an opinion about things that I've seen and some of the more popular reasons why people lose their teeth. And, I can tell you firsthand that I do think that failed root canal teeth is one of the biggest reasons I have people come into my office and need their teeth removed. And so I'm here to talk to you firsthand about that. And many of these things are my opinion, and you may hear a lot of different opinions from other people, and I'm not here to tell you who's right or who's wrong. I'm just here to tell you what I've seen and what I think. So let's talk about the issues related to root canals and why they can be a problem. First off, a root canal technically is a dead tooth that has been cleaned out as best as the dentist can clean it out and filled with a foreign material. This is a dead tooth, and what the dentist will do is there'll be an issue where there's been a deep problem with the tooth, and it could be a crack or a cavity, and it gets down to the level of the nerve of the tooth. And at the very central part of the tooth, there's a nerve, artery, and vein. On the outside, you have white enamel, and then the next layer, there's yellow dentin. And at the very heart of the tooth, that's where the living part of the tooth is. So teeth are not rock hard, solid objects that are in your mouth and disconnected to the rest of your body. They are living things, and when they crack or when cavities eat their way down into the living part of the tooth, they will become contaminated with bacteria. And so when this occurs, you really have one of two choices. This is really where the rubber meets the pavement. You can either extract the tooth, because this tooth is certainly going to die, the nerve tissue will die, or you can do a root canal. And what the dentist will do is they will remove the nerve and the artery and the vein and the blood supply all the way to the tooth, which is at the center of the tooth. And then they will clean and sterilize that tooth as best as they possibly can, and then they will fill it with a material called gutta percha. This is a foreign material. It's best described as like a rubbery caulk-like material, and then essentially the tooth will be hollowed out, and the dentist will put a crown over top it so it doesn't over time break into pieces, and that's sort of how things are. But one of the problems with this treatment is it really is impossible to get these teeth clean. Cleaning the structure at the center of a tooth is much like a sponge. So, and there are hundreds and hundreds of miles of pores and little caves and tubes inside teeth. And there's no doubt that there's a central part of the tooth where a majority of the living tissue is, but off to the side are tons of other branches where the dentist just plain old cannot clean. It's like you trying to sterilize a sponge you wash dishes with. You know, you can get bleach in there and you can wring it out and put all kinds of soap in there, and you know, you'll get most of the yuck out of there, but smell that thing a few days later and it stinks. And most of the time it smells like mold and bacteria. And that's exactly what happens inside these teeth. So even with the best attempts to clean the tooth, bacteria and fungus and other things can remain trapped inside these teeth. And the dentist will essentially put the filling material in there, which will seal much of the central part of the tooth. And the goal is to prevent, you know, any bacteria from leaking out of the tooth and into the bone and causing bone infection. And the truth of the matter is, the day you have the root canal done, there's bacteria and dead tissue in there. And every day that goes by, there's going to be more and more and more bacteria and fungus and what have you in there. So this sort of frames the problem, you know. And the thing with the root canal tooth is it creates like a unique situation where there is a reservoir, you know, a space inside this tooth where there is no life. Every other part of your body, there is blood supply, and where there's blood supply, there are white blood cells, and the white blood cells will immediately or very close to immediately detect any bacterial infections, and it will defeat, well, hopefully it'll defeat the infection and you won't get sick. Whereas in this root canal tooth, you have bacteria and pathogens and toxins that are allowed to multiply and proliferate and be unchecked from the immune system, and cannot be, it's essentially an infection that can't be defeated. And slowly over time, the bacteria and the toxins and the pathogens will leak out of your tooth, and your body will more or less have to deal with this. And that's really all there is to it. In a healthy individual, most of the time, the immune system will destroy and kill the bacteria and filter out the toxins, and most people will have no symptoms and they will not have any problems. Okay, so the bacterial issue inside the tooth is the first issue. The second issue is the root canal tooth is a dead tooth. And your body is very good at determining things that should and should not be in your body. There can always be rejection issues. If you were going to have a liver transplant, the biggest concern would be with rejection. And rejection is exactly what may happen if you have somebody else's liver transplanted into your body. Oftentimes we have these same problems with dead teeth. If a dead tooth is seen by a white blood cell, your body may determine that tooth does not belong there, and it's a really big problem because the tooth is embedded in your jaw and your body can't easily get rid of that tooth. I will be honest with you, I can't prove that this does or does not happen, but I have heard of that being a concern, so I will just bring this up as something that I have heard other holistic dentists and holistic practitioners state it could be a concern. Nowhere else in medicine does filling a dead organ or other part of your body and maintaining it once it dies, is that an acceptable form of treatment? If you had an appendix die, you would have what's referred to as an appendicitis, and that would necessitate an immediate surgery for somebody to go in and take that out. If you had a dead finger or a gangrenous limb, that would necessitate you removing that to prevent infection and you getting sepsis and that potentially killing you. But for some reason or another, having a dead tooth in your mouth is not seen as a problem. So I'm just sort of framing the issue. The third issue is root canal teeth are porous. All teeth are porous, as I pointed out before, and they are full of foreign material in addition to bacteria. And there's no question that if you have root canal filling material and sealer in the roots of your teeth, that small amounts of that and small particles of that filling material can leach out into your system and become a systemic irritant. And that's not a foreign concept. People are allergic to things all the time, and it would be very difficult to really tell. We do have these tests called biocompatibility tests, which are antibody tests, and I myself have administered these tests to many people, and I can tell you that most of the people that I've tested had come up positive for antibodies against the sealant material and the gutta percha material inside the roots of these teeth. At least one of those, they typically will be positive. So what that tells me is that the material in the roots of these teeth is a bioreactive material. And bioreactive materials are not good materials to put into the body. What you really want is you want inert materials. That's why materials like titanium. Titanium is a material we use for dental implants that very, very, very few people are allergic or reactive towards. Zirconia is another material that has very, very little bioreactivity. So this is a very suitable material. And there are many other examples of this, and we're familiar with this sort of thing with foods we eat. There are certain foods that hardly anybody's allergic to. Like, nobody's allergic to water. I've seen very few people allergic to celery and carrots, but for some reason or another, there's a lot of people that are allergic to peanuts. So in that same way, dentists will select materials that are not that bioreactive. And long story short, I'll just go back and summarize the three main concerns with root canals. The first concern is the issue where with a root canal tooth, you create a part of your body where there can be bacteria and viruses and fungus and toxins that cannot be defeated by your immune system. There's no blood supply in there, so your body would be forced to deal with whatever leaks out of that tooth. The second issue with root canals is it is a dead tooth. Having something dead in your body can subject it to rejection. The third issue with root canal teeth is they are filled with foreign material, which your body may be reactive towards. And this is the same thing you might find with an allergic reaction. So there you have it. My name's Dr. Adams.